Part 2, Public Health and Vaccination History. Do you know enough to make an informed choice regarding vaccination for yourself, your children, or help with guiding the choices for your grandchildren or your pets? Most people do not. Continue viewing and learn more. What were the typical conditions in large cities from 1750 to 1950 and even later? And it matters little whether we look at conditions in Paris, London, New York City, or San Francisco. Streets were narrow with little sunlight, but household waste, animal waste, and an occasional fetus was found in the street. Smell was terrible, of course. Sewers were constructed of bricks, leaked into drinking water, and thus contaminating it. A yearly bath was common. Food was good part of the year, typically in summer and fall. But by spring, variety for poor people was very limited. Overwork, exhaustion, and poverty were common, contributing to poor health. From about 1750 onwards, some nutritional facts were discovered, such as citrus fruit to prevent scurvy. Street cleaning and garbage collecting began. City planners increased the width of streets so they got more sunlight. Houses became better ventilated. Better plumbing and cleaner water became common. Trains and later trucks created faster farm-to-table food transit, refrigerators and freezers. Other improvements in food preservation occurred. Millions of lives were saved. But what saved them? This multi-disease graph, we will start with diphtheria. Around 1900, we had 40 deaths per 100,000 population. But before the first vaccine was introduced, we had fallen to around 15 deaths per 100,000 population. Note this decline in mortality from 40 per 100,000 population to 15 per 100,000 before the diphtheria vaccine was introduced. Typhoid fever. Again, over 30 at the beginning of the century. There was a vast decline in death associated with typhoid fever without vaccination. Scarlet fever, another disease that was very important, yet almost disappeared without vaccination. Whooping cough. This orange line, we had a maximum here of around 1920, and the vaccine became common use in the late 40s. So whooping cough declined for many years before whooping cough vaccine was used. Measles, also an important disease. In the USA, death associated with measles declined 97.5% before vaccination began in 1963. Similar situation with polio. This example of a pro-vaccine presentation claiming that polio vaccine eliminated polio, but see the notes on the graph. In 1952, this peak, polio cases included non-paralytic as well as paralytic. By 1955, only the paralytic cases were counted. In the 3 years following the introduction of the vaccine, One, the definition of epidemic was changed from 20 to 35 cases per 100,000 population. Definition of polio was changed from paralysis for 24 or more hours to paralysis occurring for 2 months. The remaining polio cases, that is the non-vaccinated, were then diagnosed as meningitis. Here's an example of hiding polio. The Los Angeles Health Department in July 1955 said they had 273 cases in the preceding year, whereas they had 50 cases of meningitis for a total of 323. By July of 1963, 31 cases of polio, 151 cases of meningitis for a total of 182. By 1966, polio was down to 5 cases, but meningitis was up to 256 for a total of 261, which is not greatly different than the 323 of several years before. Today, polio is called acute flaccid paralysis, AFP, when it occurs in vaccinated individuals. The World Health Organization report for the African region shows that infant mortality, that's death in the first year of life, went from 150 per 1,000 births in 1960 to about half of that, 75 or so, in 2009. Death in the under 5 age group went from 250 to about half, or a little less than half of what it was in 1960. But you'll notice that in 1980, a whole bunch of vaccines were introduced. These different colored lines shows the percentage of vaccinated with diphtheria, tetanus, pertussis, measles vaccine, polio, tuberculosis, and tetanus. Yet the decline in mortality in both age groups is almost flat. The vaccines made no significant difference. So again, we see a decline starting before vaccination, continues without any significant change after vaccination. Conclusions: millions of lives were saved by improving conditions of sanitation and nutrition. Vast declines in mortality were virtually at the same rate before versus after vaccination. Sometimes there was even a slower decline following vaccination. Graphs alone tell us that vaccination is of little, nothing, or possibly even a detriment to public health.